Thank you for your attendance. Today, we would like to present a new concept for a medical facility, Birmingham Long-Term Ventilator Management. BLTVM, for short, is a long-term acute care facility located in Birmingham, Alabama, specializing in adult patients who have failed to wean from a ventilator during hospitalization. We're traditionally governed by a CEO, Board of Trustees, and Chief of Staff. Our team consists of physicians, advanced practice nurses, physical therapists, registered nurses, respiratory therapists, nutritionists, and you. We are further organized into micro, macro, and mesosystems. Some of our microsystems include nutritionists, respiratory therapists, and patient care techs. A mesosystem can be defined as small groups of professionals working together, such as an interdisciplinary team, or a group of microsystems that work together. At BLTVM, we provide the best quality long-term specialty care for our adult patients who live with the need of long-term ventilator management. Let's take a closer look at our patients. We anticipate that most of them will come from the Birmingham or the surrounding Jefferson County area. Although Birmingham is not the capital of Alabama, it is in the largest county, Jefferson County. We have over 660,000 residents as of the year 2000. For every 100 females, there are at least 80 males. The median household income is $38,000. 53% of the citizens are white, while 42% are African American. The remaining 5% are made up of different races. Alabama ranks second in the nation for obesity. This has been associated with a higher incidence of kidney disease, cardiovascular disease, COPD, or chronic obstructive pulmonary disease, and metabolic syndrome. More than 22% of Alabama adults smoke. Smoking has been well documented as a significant risk factor for developing COPD, and COPD is a known cause for failure to be weaned from mechanical ventilation. Heart disease is the single leading cause of death in Alabama. It's also a frequent cause of weaning failure. At BLTVM, we pride ourselves on taking a team approach to managing our patients. Everyone is working together to achieve the same goal: ventilator weaning and discharge. BLTVM is taking an evidence-based, multidisciplinary approach to long-term acute care. Advanced practice nurses, dietitians, and respiratory therapists are directly involved in patient care in comparison to the more traditional physician-directed care. BLTVM will accept the following forms of payment: VA benefits, Medicare, Medicaid, private long-term care insurance, and out-of-pocket pay, with the exception of checks. Checks will not be accepted. The largest portion of our budget will go towards personnel. To sustain our facility, we intend to offer services that can be billed for reimbursement, such as the pharmacy, medical and surgical supplies, and the room and board for rehabilitation and intensive care. We realize that there may be times that our patient base for vent weaning will decrease, and during those times, we will continue to seek and accept patients that are not stable enough to be discharged home, but still not quite sick enough to continue being in the hospital. This would include those needing complex wound care, intensive respiratory care, and ongoing dialysis for chronic renal failure. What's so innovative about our facility is that we're independent and we're specializing in taking care of those long-term patients who need help being weaned from a mechanical ventilator. So our care and our resources are focused primarily on pulmonary services. This will allow us to provide quality but still cost-effective care for those same people who would otherwise be kept in the hospital or some other type of acute care facility. In addition to this, we could still provide the special care for those with serious medical conditions and still maintain an atmosphere that promotes holistic management of our patients. Currently, the CMS does not have quality measures that pertain to ventilator management specifically. Therefore, we're going to be documenting on quality measures that speak to ventilator support in the ICU setting. We'll continue to have weekly meetings to look at trends in our patients' care and make any necessary adjustments. Down below on this slide, you'll see the care item set that looks at functional quality measures as well as self-care measures and mobility measures that we continue to look at for our patients. Health informatics is a very important part to the operations of our facility. We'll have a fully functioning electronic health record system, employee identification cards that also double as smart cards for access and documenting in our patient records. Our medications will be barcoded to help decrease the chance of medication errors. And there'll be a very easy tool for graphing to trend patient status and changes such as lab values, weights, intake and output. We like to partner up with UAB Hospital for our patients' care as well as to electronically exchange patient charts and other data to help ease their transition of care, and if a hospital admission is required, to also help ease that flow. Although we were already have an electronic health record system in place, we are aware that the Affordable Care Act actually does require this for all facilities. As needed, we will bring in outside consultants to ensure that we remain compliant to this requirement. Although the Affordable Care Act has already been signed, there is still considerable debate and even court proceedings regarding its implementation, validity, and even the legality of it. So we're continuing to watch this process as it unfolds. There was a program called CLASS that was originally included in it. It stands for Community Living Assistance and Support Services, which would have been a very big help to those needing long-term care outside of the hospital particularly. Unfortunately, this was repealed from the act in January of 2013. However, there are still some incentives still available to expand home and community-based care. Again, we'll still just be watching how these proceedings unfold. Listed below are the references that we used to compile today's presentation. We sincerely thank you for your attendance and your attention. We look forward to working with you in the future.